Good day. This is On Call with Doc Dave, episode 2. Today we're going to be discussing a common and potentially dangerous and deadly disorder called deep vein thrombosis, or better known in the medical field as DVT. Now, what is DVT? Definition of DVT is basically a blood clot in the venous system, 90% of the time in the lower extremity, occasionally in the pelvis, and less occasionally in the upper extremity. That blood clot that forms in the vein can become fragmented and dislodge, and generally when it goes from the lower extremity, the leg, it will come up through the venous system in the abdomen, called the inferior vena cava, and go into the heart and then directly go into the lung. And once it goes into the lung, it gets trapped as the veins get smaller, and it will clot off that particular part of the lung, causing lack of circulation to that area of the lung and cause the lung to die. And if it's serious enough, it can cause the patient to expire due to the fact that you will have complications from this, such as fast heart rate, low blood pressure, shortness of breath, difficulty breathing, and coughing up of blood. So that's basically what a DVT is and how it works and what makes it so dangerous by going into the lungs, which we call in medicine a pulmonary embolus. And so what I'm going to discuss now is symptoms of a DVT, number one. Number two, I'm going to tell you how we diagnose it and how you diagnose it. Like I said in my first episode, most of these conditions I'm going to discuss, you can partially diagnose it yourself, and that will lead you to seek medical care and get treatment for this. The third thing is going to be the treatment of a DVT. And the last thing will be, how do you prevent a DVT? So let's just start off today and we'll discuss the symptoms of a DVT. Usually what you get is in your lower extremity, a lot of times in the calf area, sometimes behind the knee, which we call the popliteal area, and most dangerously in the thigh area. You'll develop a pain, it'll feel like a knot, and you'll start to get swelling in that leg. And you'll notice that maybe the veins in your feet are distended, your leg becomes somewhat discolored, usually red and warm. And then when you try to ambulate or weight bear on it, it's going to be painful. So it's pretty obvious, once you get those symptoms, you're going to start thinking, hey, something's going on in this leg. I'm wondering what it is. And now, once you listen to this episode, you're going to know it's a deep vein thrombosis. So that's usually the presenting characteristics of this disorder. Now you ask, well, what's the mechanism that causes this disorder? What makes it develop in your leg, in my leg, and why? What did I do to bring this on, and how can I prevent this in the future? So usually the mechanism of a DVT, it could be a number of things. It could be a traumatic injury to your extremity. In other words, you either get a strong contusion, a pretty, intense contusion to a muscle, which causes internal bleeding in the muscle, which will cause a blood to clot. Or it could be a fracture. Obviously you break a leg, you got to be concerned about developing these types of clots due to the circulation impediment from the fracture. Now, post-op is another cause. Hip replacements is a high priority of causing for DVTs. So usually after these types of surgery, they will put you on a blood thinner for a period of time. Your doctor obviously will follow this. He will initiate the treatment and follow it through. And any kind of disorder where you're bedridden, if you had a stroke, if you're, ill for a long period of time, if you're in a hospital and you've had surgery and you're just laying in bed for a week or whatever, these are conditions that can precipitate a DVT. And a lot of times when you're in the hospital and you're going to be in bed for a few days like this, they'll put what's called TED stockings on you, which are those compression calf stockings that you see people wear, goes over your feet, obviously, and then goes up to your knee. They're usually white, and they're what we call compression stockings. Other things that can, lead to a DVT is just age. As you get older, your circulation changes. You get your veins aren't as pliable as they used to be, so they don't expand and they don't contract as much. So therefore, the blood gets a little stasis. It doesn't flow as evenly and as active as it used to be, and so therefore you can get a DVT just from age. Other things are cardiovascular disease, where maybe you have congestive heart failure and swelling of the lower extremities, what we call edema, and that impedes the circulation as well. Last thing of importance, though, is even in relatively young, healthy females, if you smoke and you're on birth control pills, that's a deadly combination for developing a DVT. So you got to be careful with that. So you take that serious. If you're taking birth control pills and you're a moderate to heavy smoker, it's a high risk factor for developing a DVT. So the next topic here will be the diagnosis. How do you diagnose? How does the doctor diagnose? Now, you've come up with your suspicions. You call your doctor, say, got a swollen leg, this, that, or the other. So the first thing he's going to do is order a blood test for you, and it's called a D-dimer. And the D-dimer is elevated. That's an enzyme that's released from these blood clots. If that's elevated, then you have to go to the next step, which is called a duplex Doppler ultrasound. And what that is, they put a little gel on your leg, they run this ultrasound wand over your leg, and they look at the veins. And if they see obstruction, you got a DVT. They could even look at the arteries, but usually they're looking at the veins. So that's pretty simple. D-dimer, Doppler ultrasound. Now, what's the treatment for this? Well, the main treatment is, obviously, your healthcare professional will put you on what's called an anticoagulant or a blood thinner. And that's something you're going to have to not only take, but have it monitored, because these are, potentially dangerous medications, because if you get too much in your system, you can have spontaneous bleeding disorders, nosebleeds, coughing up blood in your stools, vomiting blood, easy bruising. So you got to make sure that you monitor these anticoagulants closely. And what the doctor will do is every couple of weeks or whatever, he'll draw some blood tests from you, and they'll see what the range is. And if you're in range, then they keep you on that level. If you're too low, they may add more of an anticoagulant. Obviously, if you're too high, they'll hold it for a few days until it gets back down to the normal level. So that's the basic treatment for this as far as your physician is concerned. Now, what you can do, you keep your leg elevated, let it drain a little bit, put some warm compresses on it so your circulation improves, wear your TED stockings, and, do some minor to moderate ambulations. You don't want to be going out and walking 4 or 5 miles or running or anything aggressive like that. But that's, usually how you yourself can treat it. Now, the last thing is, how do you prevent it? Well, if you're going to be in a sedentary position, usually in a sitting position where your hips are, 90 degrees to your pelvis, and like if you're in a car ride for a long period of time, 4 or 5 hours, you got to stop, get out, walk around. Don't just sit in the car and drive continuously for that period of time. The other thing that you can do is, like if you're in an airplane, that's a major one. You're taking a 12-hour, 14-hour, trip overseas. You got to get up every couple of hours, walk up and down the aisles, do some stretching, And don't just sit in your airplane seat for 10 hours without moving around, because especially if you're in economy, your legs are cramped up. You got a 90-degree angle on your pelvis the whole trip, and you're not comfortable, and your circulation's not comfortable. I can tell you that for sure. So that's another thing that you can do to help resolve this, or to prevent this, I should say. The other thing is, wear loose-fitting pants. Don't wear pants like tight jeans or something where it's going to be cramping your legs. And the last thing that's easy to do is put those TED stockings on. They will continue to keep compression on your lower extremities as you go through this process of sitting for long periods of times. So that's kind of DVTs in a nutshell. Just to summarize it, lower extremities, usually the calf is not as important as behind the knee, which is not as important as in the thigh. The thighs are the real dangerous ones. It's called the saphenous veins, because there's nothing keeping that from breaking off and going into your lungs. Your symptoms we went over: painful, swollen, red, tender leg. Diagnosis, pretty simple: blood test, Doppler. And the treatment, again, is relatively simple, but could be set with complications. So you got to make sure the blood thinners are monitored. If your doctor tells you to come in a week to get the blood test done, you got to be there and get it done. You can't overlook it, because this could be a real potential complication. So there's your DVTs. I hope you enjoyed this episode. I will follow up with more interesting episodes in the past. If you like this episode, obviously you like it, push the like button. If you like it even more than that, push the subscribe button, because we'll have some really good, entertaining episodes in the future. So it was nice talking to you again. Thank you for your time. And remember, I'm your friend, not your doctor.